Well, first of all, I want to thank the Irish Homeopathic Society, especially Oana. Thank you for all the efforts to make this webinar happen. We had some cancellation with the dates, but thank you so much, Oana. And I also want to specially thank our two colleagues, Ezgi and Serpil from Turkey, to kind of agree to do this last minute. Thank you so much on a Sunday evening. And of course, Naomi, thank you so much just after Christmas to join and put this energy for the entire Hungarian colleagues also. And of course, along with Oana, I want to thank the entire Irish society team, Dr. Sushma. Good to see some Indian colleagues in Ireland also, and of course, and the entire society. I'm not, I can't see all the members in the panel group, but I'm aware that there is a huge society who's trying to do some good work there. Perfect. So let's start for the day. I hope that Hmm. I hope that you all can see me and hear me okay. The presentation is okay. You can see the slides. I believe so. And we almost have close to about 400 colleagues who have joined here today. So this is good. So what is the topic for today? The topic for today is I'm going to share some of my latest experiences and I'm going to talk about multi-dimensional homeopathic approach and how to bring different approaches together and how to choose the best possible remedy for our patients. We will start with Master Hahnemann, of course. The keynote of the entire homeopathy is still individualization, as Master Hahnemann always spoke. Yeah. And bringing all the ideas of Kent, Burnett, Boger, Herring, Bonninghausen, and so many great homeopaths together. The multidimensional approach that I'm talking about brings together so many different approaches together, including the idea of classical homeopathy, the importance of organon, repertory, materia medica, the importance of nosodes, sarcodes, bowel nosodes, Burnett's methods, intercurrent remedies, even Schussler tissue salt repertory, contemporary homeopathic approach, including the idea of kingdom, miasm, source, themes, etc. So we'll talk about all of this as well. So what we'll try to do is we have about roughly about 70 to 80 minutes. I will try to share with you about three or four interesting cases, different approaches, and then we'll also hopefully have some time for some question answers and some pointers as much as we possibly can. I'm going to straight away start with a very simple but a very different case, very interesting case. One of the topics which I'm working on more and more, and cases that I'm seeing a lot in today's times, is a lot of ophthalmic cases, a lot of eye disorders, right? It's very common. Many ophthalmic cases, right from cataract, glaucoma, Chalzion, styes, macular degeneration of the eye, optic atrophy, nystagmus, so many different diabetic retinopathy, hypertensive retinopathy, dryness of the eye, so many herpes around the eye. So many of these kind of health issues have no long-term solution in allopathy. And this is something that many ophthalmologists, eye surgeons know. And many of them have some quite beautiful cures in homeopathy. I'm going to start this talk, first of all, by telling you that, of course, most of you already know that both my parents are eye surgeons, they are ophthalmologists. In fact, I will be inviting my mother in one of the sessions sometime to talk about ophthalmology and homeopathy also. She's the eye surgeon practicing for last close to 40 years. And now, of course, she's a converted homeopath and she practices homeopathy as well, with me, with our entire team. But I was inspired into this by one of my teachers, that is Dr. Vijay Vaishnav. And many years back, maybe 15 or 17 years back, when I was attending his OPDs and outpatient departments, I used to see some really remarkable cures in ophthalmic cases with help of homeopathy. And one of the important thing was that he knew as much as ophthalmologists about the anatomy of the eye, about the diseases of the eye, about the physiology of the eye, about the pathology of the eye, and that made him be in a much better position to cure many of these problems. So when we talk about this, and before I talk about homeopathic approach, I think it's extremely important that homeopaths should at least know a very basic understanding of kind of ophthalmology, anatomy, pathology, and clinical medicine related to eye. I think if you know this, then the homeopathic part of it, the materia medica, the organon repertory, is going to just give you a lot of added ideas to curing this. So I'm going to start with the first case. The first case is a simple case, but a very interesting case. It's a case of a Chalzion. Um, and you can see it's in a 6-year-old child. Okay, I'm going to share the case with you, but I am also going to ask you to analyze and tell me the possible remedies. Okay, that is also something I'm going to tell you. I don't want to give a lecture or a talk. I want all of you to participate and share your experiences and write to me what you think about. I think that's very important. So let's come to the first case. This is a case of a 6-year-old child with Chalzion, and you can see what is a Chalzion. It's also known as a hordeolum. I want to just tell you a little bit about what is a chalazion. It's not a cyst, but it's a kind of a granuloma around the eyelid that comes from a blocked meibomian gland, and it can happen in any part. You know, in the medial part, in the central part of the eye, it can upper style, lower style, it can be anything. So let's come to the case. So I saw this case, I think a few years back, and the mother just came and met me, and she said that, my child has this tie. I hope you can see this picture on the screen. And are you able to see the picture on the screen of the Chalazion? You can just write a yes on the webinar chat, so I know that you can. Okay, most of you can.
I can't.
Perfect. You cannot,
Nope.
Oana? Oh, that is strange because when I asked them on the webinar chat, everyone has written yes.
Oh. Hmm.
I can see that.
In the phone, you have to shift the screen on.
I have to.
You have
Shift the
to
screen.
shift the screen. You have to do like
Oh,
this.
yeah. Come on.
Can you see now?
Yeah, yeah.
Okay, cool.
Thank you.
Okay, perfect. No, no problem. But I'm glad that everyone can see. So this is the case of a chalazion you can see here, and the mother brought this child to see her, and she gave me a very short history. And this is one of the cases which you will see in your clinics where patient gives very short symptom group or very short symptomatology, and you have to prescribe based on very short symptoms, right? So how to prescribe in cases with very few symptom, even that is a very important art, and I feel that it's very important to master this art. So this chalazion, well, the doctor, the allopathic doctor had suggested that if this tumor in the eye doesn't get cured, you have to do a surgery and remove it. And of course, the family came from a very simple background, and they said very straight away that, listen, we don't want we don't want to do a surgery. We can't afford a surgery. Can you do something with homeopathy? Okay. So, well, I was very confident. I took the history, and I asked the mother, can you tell me a little bit about the child? And the mother said that, okay, the child is extremely irritable, very violent, and he's very obstinate, and he always wants things his way. And when he gets angry, he takes things and breaks things like this. And, the very typical story of Staphylococcus aureus that I think most of us already know about. And you know that also that Staphylococcus aureus is a great remedy for styes, right? I think most of you know. And I was so happy. I said, wow, what a case, there is this sty and there is this anger and this, and I'm like, okay, superb. I'm very happy. I'm going to give Staphylococcus aureus. The only thing is I gave Staphylococcus aureus in different potencies for 2 months, and the mother came back and said, listen, it's been 2 months. It's not getting better at all. What are you doing? And if you can't, then I don't know what to do because we can't afford to do a surgery. Can you do something? Wow. So this was the situation in which we were in. And perhaps some colleagues can write what could be the possible remedy. You can write in the webinar chat. You can write the possible remedy and you can also write the reasons, that is also okay. Right? There are some suggestions here I'm going to read. Dr. Ashish writes it's belladonna. I think that's, yeah. Someone writes it's euphrasia. Someone writes it's mercury. Someone writes it's silica. Someone writes it's hipar. Has many, many different suggestions. A lot of colleagues write thuja also, thuya. But you can also write the reason for it. Now that really helps for me to understand. Okay, no problem. Let me come back. So what did I do? I tried to analyze the case further, right? And I realized that this is a pathological case. And if I focus just on anger and violence, and I might go in a story of the mother and go somewhere else, I need to prescribe a kind of a pathological prescription. There are different types of prescription. This is also important to know that in homeopathy, there can be different types of prescriptions. I'm going to write here different types of prescriptions in homeopathy, right? One, of course, we know is finding the constitutional remedy, right? One, of course, where you try to understand the miasmatic approach, where you would also consider remedies like nosodes, etc. Right? One is where you prescribe only on the mind. One of them is what is known as the pathological approach. Now, this is where you are just prescribing based on pathology. Master Boga would use this approach a lot, right? The great Master Boga. So now I started thinking which is a remedy which has specific action on the eye tumor. That's it. Nothing else. Only that. And when I started studying about this, I found a very interesting remedy in Boric and Clark Materia Medica and Repertory. And the name of the remedy is Platanus. Okay. I'm going to read it for you. It's called as Platanus acerifolia. Okay. This is not platina. Okay. This is Platanus. It's a plant remedy. Okay. It belongs to the Platanaceae family. And let me read from Boric. I'm going to read this from Boric for all of you from the generalities of Boric. And if you have Boric with you in any language, you can just open Boric. And I always tell you this to all my friends, always keep Boric on your table. A real Boric, not a software of Boric, but a real Boric Materia Medica. It's going to just help you. And every time you see any case, wherever you want to prescribe, just go over it once. So the first word written in Boric, you can read here, it's written tarsal tumors, right? And then it's written both in acute and old neglected cases where destruction of tissue occurred and cicatrical contraction caused marked deformity of the lids, restored to practical normal condition. And then, very interestingly, it's written acts best in children. Quite fascinating for me when I saw this. Must be used for some time. Ichthyosis. Right? So this is like one of the most near specific remedy that I found in Platinus. Of course, after this case, I learned a lot about it, and I've been using Platinus a lot in more of my cases. Let's see again. And I just gave Platinus 30. I'm going to show you what potency I gave. I gave Platinus 30 and Platinus 30, and I just told to take twice a day for 15 days. Asked to repeat it again after 1 month. And this is a picture after 45 days. And you can see very beautifully that the sty has disappeared, totally disappeared, never came back. And we were able to treat this, let's say, uh, a failure case of mine where I kind of typically, failed with Staphysagria, which I felt was the classically well-known remedy, and it matches everything and it helped with Platanus. Let's first also study a little bit about Platanus. Okay, I want to share with you also how to study the remedy, especially if it's a rare remedy. Let's have a look. So you can see here, Platanus, one of my favorite books to read, a little rare remedies, Clark Dictionary of Practical Materia Medica. It's a remarkable book, right? Platinus. And Burnett was the chief person, you can read here, was the chief person who used a lot of Platinus, and not only in tumors of the eye, but typically also in many, many cataract cases and even in skin pathology. He writes, Platinus he has used a lot in cases of ophthalmology in children. The other good book I want to tell you, which you want to read rare remedies from, it's written here. I hope you can see this here. Anschutz New, Old and Forgotten Remedy. This is a very nice textbook of old remedies, of forgotten remedies, of of some rare remedies. It's a fascinating book. There are about, I think I have it on my table also somewhere. Let me see if I have it. Yeah, I have it here. Luckily. Let me show you how it looks. It's something like this. Can you see this on the camera? I hope you can see this. This is the book. Okay. It has it has about roughly 40 to 50 rare remedies, and it has a lot of cases of that rare remedy which have been used by homeopaths in the last century or so. And really beautiful the way, like for example, now when this Platanus in Anschut's book, he has given many cases of where the Platanus was given. You know, you can see here. Here is given. I'm going to just show you. It's I can just present to you 10, 12 cases and that's it. But it's important for me to share with you how to study these remedies, how to go deeper, how to, you know, decorate these indications in your mind when you read about it. So you can see how it's written. Case one, some Miss Betty, age 3 year old, and there is small growths on the lower eyelids around tarsal cartilage, unable to move, and Platanus is given, and in 2 weeks the tumor disappear. Case after case like that are given here, and then it's written Platanus in generality is written Platanus will often soften and remove Chalzion. It acts better in children and adults, and then it's written that it must be persisted for a long time. Interesting. Which means you can't just give one dose and forget it. This is not that type of remedy. It's a remedy where you need frequent repetitions. So this is what I want to tell you about it. Also, another book that I used to read about this is, if you want to read about tumors, is called as Burnett's Tumors. Okay, this is a very nice book by Burnett. Burnett has written these small booklets. Like for example, it's quite. I'm lucky today to find some small booklets of Burnett. This is one of the small, tiny booklets. I hope you can see this in the camera. Maybe it's a very small. It's probably will go in my pocket, here. It's a 99 kind of a 95 pages small booklet, and this is a booklet, Homeopathy, enlarged tonsils cured by homeopathy by Burnett. So such kind of small booklets are booklets written by Burnett, and of course now there have been so many collections of it. I think many of these booklets have been collected together into another book called as Best of Burnett by Chitkara. This I think is available by so many publications. But the beauty of these books is in this format where you have to take it and keep it in your pocket and read it while walking on the streets or having tea or something. That the whole fun of this book is in that. So I mean, try to get this once if you wish to. So here, Master Bernard, he explains about Platanus, and he explains about how he treated a cyst in a right upper eyelid with Platanus in a 30-year-old lady. He explains the entire case, and he shares about other cases. So this is how you want to read about the remedies, right? It's also a nice thing for you now when you look at the hindsight, and you also want to understand which kind of family or which exact source it belongs to, which plant subclass it belongs to. It's a nice idea for you to keep this in your mind as well, right? So here it's written that it has some kind of connection with Hamamalidae family, that is the Urtica family, that is the cannabis family. So somewhere you will see that kind of a connection also. So this is good for you to keep it in your mind. So this was the first case. Um, let's go ahead. Let's go to the next case before we go ahead. Let's see if I can share with you some more cases. Okay, this is a good case. So this is a case, another very interesting case. This is a case of post-COVID conjunctivitis. Okay, this is quite a fascinating case because this was a case of a 29-year-old lady who came to meet us, who had conjunctivitis that started after COVID. So she had COVID, and it is kind of a post-COVID syndrome for this young lady. Okay. And she's come to us to take homeopathic treatment for this kind of a chronic conjunctivitis kind of state. Okay. I hope you can see this on the screen. You can see her congestion around the eye, the conjunctivitis, the pain that the lady is undergoing. So let's start. So she comes with the initial complaints of lot of cough. Okay. Cough, dry cough. She is able to remove 10% of the expectoration. The cough is extreme, paroxysms of cough. She had COVID, and during COVID, this cough started. Okay. And this cough is aggravated by draft of air, by talking, by touching the neck, by covering herself. All these increases the cough. She also, along with cough, has developed a lot of palpitations, feeling of heaviness on the chest, aggravated by lying on the back, better by lying on the right side. And the conjunctivitis symptoms, where there's a lot of pain, typically pain in the right eye and pain on blinking the eyes, lot of conjunctivitis, redness, itching, burning. It's a shooting type of pain that she kind of experiences, aggravated by blinking the eye, turning the eye to the sides. In general, aggravated by draft of air, better by warmth, better by covering, better by lying on the right side. So this is her presenting symptomatology. Now, here I want to tell you, when you're treating such a kind of case, you want to give a lot of importance to the modalities. I give a lot of importance to modalities when you're treating an acute and subacute case. Bonninghausen said that concomitance is the number one thing that makes symptom characteristics. So if you want to, if someone tells you any symptom, to qualify the symptom homeopathically, you need modalities. So either you have to ask the patient about the modalities, or sometimes also give them certain possibilities, that these are the different possibilities that can aggravate a person's state. You can think about it more. So it's extremely important, the modalities. I give a lot of importance to it. And here I can see that the draft of air is an important thing, covering is an important thing, palpitations better by lying on the right side is an important thing, aggravated lying on the back is important. So this modalities, even though interestingly it is not part of the eye symptoms. You understand? The conjunctivitis that she has come with has very few modalities, but the other concomitant symptom of palpitation and cough has modalities. You will still give importance to those modalities even if they are not of the presenting symptoms. This is what Bonninghausen spoke about as what is true to the part is true to the whole. So even if you see a modality in a separate area of a person's life, you give that equal importance, especially if you don't find anything else. So this is something that I want to just reiterate here. What are the other symptoms? Let's see. She has a lot of desire for salty food. Her appetite has increased. It's more in the evening. There's a lot of sleepiness and hot patient, sensitive to taking bath in the last few days. At this moment, I ask her about what is it? How did it start? How did your problem start? And she's in a lot of grief right now, actually, when we are talking to her, talking about her. And the reason for grief, one of the reason also is that her mother recently kind of died. She underwent certain health condition and she died. And for her, that was a very big exciting factor. In fact, it's very interesting that the death of the mother affected her. And after that, the COVID symptoms came up. So, a very important, exciting factor of the whole acute state is a very, very strong death of her mother. That is a very, very strong emotional impact here that affected her a lot. What is her coping mechanism? She says, I feel like being alone. I don't feel like doing anything. And there is too much anxiety suddenly now about my brother. Too much of anxiety. I'm constantly thinking about my brother. What will happen to him? How will my brother be? My brother's health, my other family members' health. There is this new symptomatology that has come in that a lot of over anxiety, over caring about my brother and about my family member. Now, this was not there before. This state of constantly thinking about the family members wasn't there so much. This is a new symptom. Again, importance of what Hahnemann said as the changed disposition in an acute state. You don't have to see what is a chronic symptom. You have to see what is the changed disposition, as Master Hahnemann spoke about in the organon. So, this was the case in short for us. Let me kind of make a small symptom totality here for you. I'll try to open a Word file if I can. Let's see. I can open. Yeah, this will be better. So, what do we know now in this case? We know that she has a post COVID conjunctivitis, right? Let's try to understand this. And along with that, she also has the situation of the redness, the congestion, a lot of pain, and all that. But along with that, she has a lot of cough, which is aggravated by draft of air. She has palpitations, which is aggravated by lying and better by lying on the right side. And when we understand her mind state, there are two or three which is important. One is the death of the mother was a strong, exciting factor that affected a lot to her. There was a lot of grief, and then actually the conjunctivitis and everything started. And second is there's a lot of anxiety about the family, extreme cares about them. This is a new symptom. This was not there before. So this is the what we can call, as Master Tyler would say it, the great Tyler, she would call this is the symptom complex. And now we have to find the remedy for this symptom complex. Perhaps some of our friends can already think about some possible group of remedies. there are some suggestions here by our friends, including, okay, there is causticum. There's a nice suggestion here by Guller. Guller writes Ignatia. It's a good suggestion. There is Natramure. The typical group of remedies we have here. But what we want to do here is not stick to this, but really kind of find the exact symptomatology. So what I'll do for you here, let's try to repertorize step by step. So let me actually also show you how you want to do it step by step, right? The whole process. Now, the first thing that I generally like to do after this is I try to think about, okay, what approach should I take, right? And there are so many different approaches that you can take, right? I think so many different authors, so many different teachers. But the thing that I look for the most is to form the totality, which we have formed here. This is a totality. But I want to see what is the most intense symptom and where do I begin with. This is very often I start with. And I also want to tell you that I also am very flexible. The most important thing about using the repertory is to be flexible, to learn to let go of what you feel may not match the entire kind of pattern. It's something like that. So let's try to do that. So first thing, yes, you want to have a remedy which has the main thing as the conjunctivitis, right? You want to have a remedy which has in it at least the pathology of conjunctivitis. So that's my first rubric. I hope you can see this. Eye, inflammation, conjunctiva. I have used the complete repertory. You can also use perhaps Kent repertory. You can use synthesis repertory. You can use whatever you want. So this is the first rubric I've taken. Second, I've taken is the cough. The cough is aggravated by a draft of air. That is a very, very strong symptom. But in general, also there is a lot of aggravation by draft of air. So I'm going to take draft of air in general. Okay. Then there's palpitations. The palpitations are aggravated by lying down. You know this. Lying aggravates. We know this for sure. But the peculiarity is lying on the which side? Lying on the right side, typically ameliorate. Now that is something interesting, isn't it? So what I will do, I will take lying on the right side ameliorate. I'm going to check it again whether it was. Yes, lying on the right side ameliorate. That's right. I'm right. What I will do now, because the rubric had only 10 remedies, I might go into generalities and write lying ameliorate during side right. So what I did by doing this, I want to just tell you, is that I made sure that I don't miss on any remedy that I might have missed by looking at a very small symptom. So in short, if this is the symptom, palpitations, um, it was lying aggravate. Huh? Let me check again. Palpitations, lying ameliorate, side on right, right? No, I was right. So when I look at this now, what I want to do is I want to combine these symptoms, something that you should know. What else? There's everything started after the death, after a lot of grief, right? But what was the symptom there? The symptom was a lot of anxiety and care about the family. So what will I take? Cares full of. What I take? Cares full of. About whom? Yes, cares full of about family or about others. The cares full of about others, you can see here, and cares full of about relatives. Okay, I hope you can see this. So when I now look at this entire story here again, there are, I hope you can see here, and what I'm doing here, lying ameliorate right, and this, I'm going to combine these symptoms. I'm going to write here lying right. Okay. So when I take this lying right, there is one remedy that looks at you constantly, and the remedy is spigelia, right? And there are more remedies. There is lachesis, there is arsenic, there is rustox, there is causticum, right? There are a few group of remedies. But the remedy that matches the entire state here is spigelia. Why spigelia? Interestingly, when you read about spigelia, you read Spigelia antihelminthica, you also know that it belongs to Loganiaceae family. You know this, Loganiaceae family. The same family as that of, yes, Ignatia, like one of the colleague very rightly said, Ignatia. So you can see this very nicely about um, Ignatia. Let's see here. Yes, you can see this about the Ignatia family, that is the Loganiaceae family, which has not only Ignatia, it has Spigelia, Nux vomica, Strychninum, Huanan. These are all remedies which have which are belonging to the strychnine family or Loganiaceae family. And what is the main pattern of this family? The main pattern is of an emotional shock, a sudden shock, grief affecting the body. Grief, shock, death, disappointment, anything affecting the body. Affecting the body in such a way that causing different pathology. Now, for different remedies, it will be different. For example, there's a remedy here, curare, right? In curare, what you will see is that there's a sudden emotional shock, and after that, the person straight away develops a stroke, and then the half of the body is totally paralyzed. Now, then you will think about curare, where there is a total motor paralysis, right? Huanan. In Huanan, there will be a situation, and after that, there could be a tumor or a big ulcer or something like that. Right? In Gelsemium, of course, you know the typical state of Gelsemium. Ignatia, you know as well. But Spigelia is very, very interesting. Why? Why is Spigelia interesting? Because when you now study about Spigelia from the Materia Medica, let's say the Boger Synoptic Key. This is one of my favorite Materia Medica book, the Boger Synoptic Key. Why? It's one of the only books that gives the sphere of action very nicely. Have a look here how it's given. Characteristic nerves, trifacial nerve affection, nerves, heart affection, nerves, neck affection, fibrous tissue, and fifth line, action on the eye, which is the main thing in our case. So this kind of sphere of action is very important to know. So if you know when you give a remedy, it's also important to read from Boger which remedies have very good action on that particular area of the remedy. And if it is very, very strong, then you are so much more confident about the prescription. So it's very, very important to look at the sphere of action as well. Okay, let's go back. Let me go back to the case. So this is what it was, and some more rubrics in the case. I took some more rubrics, which I may not have shown you in the repertory sheet. You can see fear of bath also has Spigelia, interestingly. Okay, interesting. Okay. And looking aggravate sideways is also has Spigelia. Spigelia is a great remedy for the eye, right? So that's what I did. I studied. And some more rubrics of Spigelia. Have a look here. Cares full of, I told you about. It looks like causticum or cocculus. Spigelia has a mind state like cocculus or causticum. They are very anxious about their family members, extremely anxious. But the sphere of action is different, and the strong exciting factor is very different. They have an emotional sensitivity aggravated after death of someone or a very big grief. Grief affects them. Grief affects them a lot. So it's very important also to know, grief can affect different people in a different way. For example, there is another remedy. I have a very fascinating case where this particular lady, she lost her son. And she lost her son because of a very horrible surgery that went wrong. And she can't get his thought out of her mind. It's a it's a lady who lost her son because of certain surgery that went wrong, and she can't get her son thoughts out of her mind. And I've given her everything, Ignatia, this didn't help. The remedy that helped the most is a remedy called as Cygnus. So fascinating remedy, Cygnus. And it's prepared from whooper swan, Cygnus. And the main pattern in this remedy is is a lot of grief deeper to Ignatia, where the person is just totally fixed in the grief and they are not able to come out of it at all. It's almost as if they fall in love with the grief, and that grief gets them more and more and more and more, deeper and deeper and deeper. They just can't get out of it. And often the experience of that is a lot of constriction and tightness that they feel in the chest and in the throat area. And she did very well on Cygnus as a remedy. You can see long standing grief more deeper to Ignatia. This is the remedy, Cygnus. So that's what I'm trying to tell you, that you have to get out of the mindset of grief means Ignatia, grief means Natromure, you know, anger means Nux vomica. I think as homeopaths of modern times, we have to get out of that fixed drug picture that we were taught and understand that there's a much broader perspective to understand. Okay, let's come back. So what did I do? I gave Spigelia 200. I gave it 6 hourly. Okay. And in the next few days with Spigelia. Why did I give 200 potency? It's a medium potency. Maybe in the end, I will talk to you a little bit about the potency, but 200 is known as a medium potency. Anything lower than 200, that is 30, you can call as low potency, or 6 low potency. Anything above 200, let's say 1M, 10M, you can call them as higher potency, right? And in cases where there is some physical symptoms, some mind symptoms, it's a very kind of a safe potency to prescribe. That is 200. One of one of my teacher would say, Vijay Vaishnav, he would often tell me 200 is the safe potency. If you're not sure to, you can begin with 200. It'll give you an idea where does the patient lie. So that's what I gave. And well, within the next 3 days, that is 72 hours, there was a remarkable change. The conjunctivitis, the pain, the eye situation beautifully healed. In 7 days, her eye situation was in a much, much better situation. You can see here. And we followed up little later also, and she had done very well on Spigelia anti-helminthica, the great remedy. In fact, Spigelia I gave on Saturday also. Yesterday, there was a child who came and met me, and he just showed a finger like this to me. She says that, doctor, here, and he showed the finger near his umbilicus. It's very painful, extremely painful, and was no other symptom. There was some history of worms in this child. And well, that's the famous keynote of Spigelia by Boric. Let's see what Boric writes as a last line in generalities. He writes, child refers to navel as the most painful part. Remember this massive keynote. Many, many colics around the navel with history of worms. Remember, history of worms is a very important thing you want to consider. Never forget this magical acute remedy, the Spigelia anti-helminthica. So this is another interesting experience about the ophthalmic case. So many more ophthalmic cases, to kind of talk to you about. But perhaps let's change the topic. Let's go to something else. There is so much, but a little less time. So we will see how it goes. Oh, no. Just drink some water. Okay, let's go to the next case. So this is a case of, I'm writing here, this is a case of a prolapsed intervertebral disc in a 78-year-old lady. Her son came to meet us and told that the lady is in a lot of pain, screaming and shouting with pain. And let's see her investigative report. These are her MRI scans, and I'm going to read them, some part of it. You can see there's a lot of disc protrusion, indenting thickle sac, compressing the nerve roots getting kind of compressed, ligament flavum hypertrophy, spinal canal stenosis at L5S1 level, central bilateral paracentral disc bulge, indenting the thecal sac, narrowing bilateral neural foramina, spinal canal stenosis, residual spinal canal stenosis, so on. So there's a lot of like pathological changes in her spine, as you can see. And this is our patient, just for us to see a little bit about the patient whom we are talking about. This is the senior lady who wants to take treatment from us. And I'm going to tell you the case in short. And of course, let's try to find a remedy for our patient. So, prolapsed intervertebral disc L1 to L5, there is a big disc kind of prolapse and the nerve entrapment. Since last few years, but especially since last 2 months, the pain is exhaustive. The pain is too much. The pain, she's experiencing pain from right hip, right, radiating up till the right feet. And the main sensation she feels is a sensation of electric shock like sensation, and like electricity going up and down. She feels like electric current, right? These pains are aggravated on walking, waking in the morning, on beginning to walk. These pains are better by lying down. And she describes the pain as exhaustive pain. In fact, in one of our consultation, she describes the pain as if the pain is killing me. I want to die. I would rather die. I would rather die than this. I would rather die than suffer so much. So she talks about dying and death-like state with that pain. So you can imagine also to understand the miasm that the patient lies in. It's very important when the patient is expressing the symptom, the suffering. The patient is also trying to tell you which miasm a patient lies in. This kind of state where patient says, I want to die. I want to die than to have this pain. Just kill me, doctor. Kill me now. I don't want to live anymore. This directly points you very often towards syphilitic state. I'm not saying that you have to give this or that remedy, but you have to consider that kind of state. Not to come to a remedy, but in your mind, you should have a soft kind of a data that, okay, this is going towards that kind of miasmatic state. So the remedy should have that layer to it. It should have a little bit of a syphilitic base. This is the way your mind should work. Materia medica remedies should not be seen only in one dimension, but in many dimension. Actually, in today's time, we know so many dimensions to world, right? Similarly, the remedies can also be thought about in like a multiverse kind of fashion. Multiverse, interesting word. Okay, so electric shock like pain, electric current like pain. The pain is aggravated on walking, waking in the morning, on beginning to walk. He's better by lying down. I give a lot of importance to past history of complaints. So she mentioned that there has been an injury. She fell down, or there was a blunt injury on the body, and a lot of her problems started after that. Interestingly, in the past history, she also had a left-sided breast carcinoma. Surgery was done, chemo was done, it was taken care of, it's now stable. since last so many years. So that is the other past history of symptoms. So a lot of importance to past history of symptoms here again, I want to tell you. Past history of symptom doesn't mean you just take the, okay, you had this problem and just write the name. No. When you say past history of symptom, you not only have to note them down, you also want to understand what were the symptoms and what were peculiarities during that time, and also how it is associated with the main complaint. For example, if someone tells me, you know, that I had a lot of kind of history of diarrhea, and after that, I had this kind of prolapsed intervertebral disc. The diarrhea, I had to take antibiotics, and the diarrhea stopped, and then I developed this. After a few months, I developed prolapsed intervertebral disc. I will think about remedies, of course, like abrotanum, calibicromicum, strontiana carb, dysentery compound. You would want to consider remedies like that. So that's why the importance of past history is important. Past history is not just to note it just as a part of case record form, but it very often helps you in your prescriptive totality, and also helps you with the prognosis of the case and understanding the case at a much deeper level. So let's come back to the case. The lady was not opening up. She was suffering a lot, so she was just moaning with pain, screaming with pain, telling doctor, the pain is so much, it's killing me, I feel like dying, do something. She feels very hungry very often. Every 2 hours she feels hungry. She's a hot patient. There's a lot of thirst. Here I ask the son, because now she's not opening up at all. And I ask her, can you tell me what is it? And she just doesn't talk. So now I take help of the son to explain me a little bit about what's happening. This is something you have to do in geriatric care. I want to just share with you that in geriatric care, there is a lot of importance to be given to patients in and around the patient. Probably in probably the geriatric cases should be considered like children's cases. In children's cases, how you study the case, you you try to study the child's history, you then talk to the mother, you talk to the father, you ask them to give your observations about them. I believe geriatric care is a little bit like that at a certain age group, at a certain type of disease. You take the patient's history, the state, but also you ask people in and around them a little bit about them, because you will get something very, very peculiar about them from the children, from the wife. For example, there was one gentleman who would come and meet me, and he came across very respectful. He'll come and say, doctor, thank you, you're helping me, I'm doing well. And one day, strangely, I was his wife came, and his wife was my patient also, and she told me some very peculiar things about him. She says, doctor, he's not doing well. He just comes and meets you because he likes to talk to you, and he's very dominating, very abusive, and he treats her extremely like a slave, etc., etc., etc. So I was giving him a remedy, something like pulsatilla or staphylococcus, someone who's very mild, and he actually was a different person, which I came to know a little later in the case. So it's very important to take observations of patients in and around, especially in this group, because in a homeopathic consultation, you may not always be able to pick this up in the first consultation. So that's why be very open to this. So let's come back. I was asking now the son, can you tell me a little bit about? So he says that she has underwent a lot of struggle, a lot of grief in her life. Her mother-in-law, although as you know, in India, this can be a quite a common kind of state, the mother-in-law, daughter-in-law problem, where there is a kind of mother-in-law and daughter-in-law, they don't get along, and etc., etc. Most of you know about it. But that caused a lot of grief for her, and she used to suppress a lot. And she also lost her daughter and her husband in the last few years. And that she used to just keep everything inside her. She hardened her emotions a lot. She made her emotions suppress a lot. And of course, later on, she was diagnosed of breast cancer. Although, generally, she came across as someone who was very confident, very strong, very smart, very social, and a little strong-minded, little obstinate. She wants to lead, and she always wants people to follow her. She's a kind of person who will not show her emotions very easily. She's generally very guarded. She's very intellectual. She will not cry very easily. She will not show her emotions very easily. She's that kind of person. A little bit more about her. I asked, okay, tell me a little bit more about her. She has a habit of keeping everything inside her. And even if she feels bad about certain things, she will not speak up. So much that she will be indifferent to her own self. Even if she's suffering, she will not tell that take me to a doctor. That is the main symptom about her. She's indifferent about her own suffering. She will she will never express that I'm having suffering, etc. That is her main symptom. In fact, she finds her health very funny. During the case history, my colleague told me that when she was giving the case history, she was laughing, you are going to give me something for the pain because, I don't even know I have pain. But the pain was extreme. She wasn't able to move, but she was laughing, almost behaving indifferently towards her health. By the way, this is also syphilitic miasm trait, where if the suffering is so much, the psoric patient will come and tell you, Doctor, I'm suffering, can you give me a remedy? The syphilitic patient has no hope, is hopeless. You're going to treat me. Nothing's going to happen. I'm going to go. That is the state of syphilitic. So the patient's expressions will also give you a lot of miasmatic pointers towards the case. She says pain is for so many years. I never told anyone because, I don't care so much about my illness. I want to die. I want to go away. Life is not worth living anymore. And I'm very indifferent towards my own health. This is my main state, she says. Just give something for the pain, or else, I'm ready to go. They say that this kind of state is more stronger because of the death of so many family members. Also, they feel that the constant feeling that the patient tells the family is that I want to die. Kill me now. I want that the death should come as soon as possible, she says. So much of suffering. Just give me some medicine, I should die. I want to die. The pains she also feels are typically the maximum at night. And the nights are the worst. She wants to die at night, she says. So, of course, there is some more things about the case, but this is the case in short. So now, this is the kind of state that we are talking about here. What do we see? Let's try to form a portrait of disease, right? What do we see? The main pathology is the bones, the discs and the nerves. We need a remedy should have action on bones, discs and nerve. The main sensation that she describes is like an electric current. It is aggravated by movement, aggravated in the morning, but maximum aggravate at night. Interestingly, her there's a history of breast cancer. Interestingly, the main state is there is a lot of indifference towards life. You can see that in her expressions, and almost wants to kill her own self, wanting death. I want to die. This is a typical state. We already know this. If you want to just understand a miasmatic understanding of the particular case, we can also consider studying in that way. So you can see that in syphilitic miasm, typically the long bones are affected. Yeah. There is a tearing pain. There is a strong family history. There is a emaciation and atrophy. There is a destruction of the bones. It's an advanced osteoarthritis, osteophytes, arthritis, avascular necrosis, night aggravation, warmth of the bed. And always the syphilitic miasm is better by abnormal discharges like pus. Cold gives them relief also typically in syphilitic miasm. So this is also a very important kind of state of syphilitic miasm. There are many syphilitic miasm remedies. Some of you have already written syphilinum, aurum, kali iode, nitric acid, fluoric acid. These are all as you mentioned, deep syphilitic remedies. Some more things about syphilitic kind of miasmatic patterns. You will see the senses are very diminished in syphilitic miasm. Yeah? There is more bony pathology. There's a dry, puckered skin, thick skin. Sometimes there will be the patient's experience of the pain numbs down. The healing becomes very, very slow. There are many deformities. Deformity is a keynote of syphilitic miasm. Many ulcers, pus, blood, these kind of pathology you think about syphilitic miasm mainly. So when you study all these things, understanding the syphilitic miasm and the feeling as if I don't want to live anymore, the remedy that we chose, of course, was the great remedy, the great Phytolacca decandra. Yes. And you can see very nicely the repertory here. The electric shock like symptom. This is a major keynote for me for Phytolacca. Electric shock like symptoms. When you see this, the first remedy that should come to your mind, when someone tells you electric shock, very often the remedy you should think, the first remedy that should come in your mind is, okay, let's think about Phytolacca. Indifference to everything. Laughing. Silent grief, interestingly, also has Phytolacca. Death desire, Phytolacca. And don't forget, Phytolacca is the main remedy for mammary tumors and mammary ulcers, which also interestingly she had. So it's possible that from the beginning she was in the Phytolacca state. And perhaps if she would have met us in the beginning, we could have given her Phytolacca much before the current state. So that's what I give. Some more rubrics. Of course, there are many more rubrics. Once you get the remedy, you can also study many more rubrics about Phytolacca. Let me very briefly tell you a little bit about Phytolacca. We have a few more minutes. Deeper understanding of Phytolacca decandra, the poke root. One of the very important symptoms of Phytolacca is death longing. Very often, one of the kind of expressions of Phytolacca, the presenting symptom is death longing. You'll see this in Phytolacca. There's a very nice symptom in the proving and also in Nair repertory. Death longing for with vomiting of clotted blood and slime, with longing for death in mastitis. Think about Phytolacca. Wishes to be killed. Doctor, kill me. Give me a medicine so that I die. Wishes to be killed in sore throat. Single remedy in the entire repertory. Phytolacca. Phytolacca is very important for throat pathology also. As you know, it's a massive remedy for pharyngitis. Indifference to everything. Indifference to exposure of a person. Sometimes the patient may not even remember whether she is wearing or he is wearing clothes or no. It doesn't mean that they are shameless or lecherous or lewd or cheap like Hyoscyamus. You will think, oh, she doesn't care about, what clothes she is wearing. And you'll think, oh, this is Hyoscyamus. No. In Hyoscyamus, the idea is to incite. In Phytolacca, they just don't care about themselves and others. It's a kind of a much later stage of syphilitic miasm. So that's why the symptom indifference to exposure to her person. Phytolacca, ladies and gentlemen. Deep syphilitic state. Interestingly, there's a very nice rubric which I use here in India very often, and I think you can use it in your country, perhaps in Ireland also, in Turkey, in Hungary, everywhere. Depressed in rheumatism, worse in rain. So when you see all these three symptoms together, the person goes into a depression, has a rheumatoid arthritis, and gets aggravated in rain. When you put these three component in a case together, you get only one remedy, Phytolacca. So think about cases who have arthritis, who are very depressed, who get aggravated during rains, damp like rustox, or you're giving rustox for a long time, deep syphilitic miasm, Phytolacca, ladies and gentlemen. Kent writes very beautifully about Phytolacca. It's very nice what he writes. This is a very imperfectly proved remedy. and it is only possible to present fragments of it. Master Kent. The mental symptoms have not been brought out, but remedy has some striking features, he says. And it resembles mercury. Quite fascinating, huh? Guernsey, another of the great homeopath, he brought keynotes into homeopathy. Master Guernsey. He writes, patient is subject to rheumatism, pains on change of weather, typically on hips, thighs, and especially chronic rheumatism. Allen, of course, the great Allen, and you know that the famous keynote of Phytolacca, it is between Bryonia and Rustox, where they are aggravated by movement, but they are also restless. So sometimes you're between Bryonia and Rustox, and actually it's not Bryonia or Rustox. The patient may require the great Phytolacca. And of course, the big keynote you can read here: pain flying like electric shocks. This is the keynote you can see, the sixth line in Allen's keynote. This is the massive keynote. Phytolacca. Clark. What does Clark write? Very beautifully, Clark writes about the fact how the ingredients are there in phytolacca and how kind of it contains an acid called as phytolactic acid and malic acid. N.M. Chaudhary, this is another fascinating materia medica which I used to read materia medica, N.M. Chaudhary. And one of the most important thing N.M. Chaudhary write is that the rheumatism is so much, it's so deep seated that the patient has to lie down. They just cannot move. So when the patient has to lie down and the pain is more in the outer side of the limb. So this is the medial side. In Phytolacca, it's on the lateral side. That is Phytolacca. So anyways, cut the story short. That's what we gave. We gave Phytolacca decandra. We gave 200 two times a day for 2 days. And if there is pain, I also make use of Schussler tissue salts. That if there's a lot of pain, instead of giving the allopathic medicines, you can consider giving magnesium phosphorus 6x in hot water, because this is like a homeopathic painkiller that I often use. And instead of giving the painkillers, I might use this in hot water every 6 hourly to reduce the pain. So this is something that we do also. And we followed up regularly. We followed up for the next 6 months regularly, and she showed a remarkable change with help of Phytolacca. You can see this perhaps in the follow-up. I'm going to put this video, and you can see the subtitling here. आपका तकलीफ, आपका दर्द कैसा है पहले के मुकाबले? How are you? You're saying I'm much better. Previously, I couldn't even walk. After taking Phytolacca, I've started walking. I'm able to sleep now. I can walk now. चल के बता. She can walk and everything. Okay. Okay. She wasn't able to get up. She was lying down all night. Didn't want to live. कितना कम है आपका दर्द तकलीफ? I feel more than 80%
उसकी
better.
वजह से आपके जिंदगी में क्या फर्क पड़ा है?
She says, doctor, you have prolonged my life. In a way, she's saying, why did you do that? Imagine, that's the Phytolacca state, no? She wanted to kill, she didn't want to live anymore. So that is the thing, homeopathic remedies, they not only can help the suffering, but the main thing is they can cause healing at such a deeper level, even at an emotional level. That is the beauty of homeopathic medicines. That was a little bit I wanted to talk to you about the case of Phytolacca as well. But I'm going to take this opportunity also to invite every single one of you for our new course, which is starting very soon. It's a 20-hour super speciality course with geriatrics that we spoke about a little bit today, and ophthalmology, with some of the finest homeopaths that you can see in our fraternity, some fascinating clinicians. Some of my teachers actually here, Dr. Vijay Vaishnav will be here. My mother, who's an ophthalmologist, she'll also be talking about some ophthalmic cases. Dr. Gajanan will be with us also. We'll be having Resie Moonen. We'll have Ajit Kulkarni, Dr. Parful Barwalia, another of my teacher, great homeopath. Of course, we have Luke Conrad, so many great homeopaths coming together for this topic, and many topics in geriatrics, renal diseases, Alzheimer's, Parkinsonism. Many people are going to have these problems or already having. And if we learn a lot of homeopathic strategies for it, perhaps we can help more. Even in ophthalmology, many different conditions and how to treat them. It's going to start on 24th of Jan, right? And well, you're going to get a certificate and everything. You're going to get a 2 year access to the course. You have to write an email to us, gaurang@gmail.com. I'm going to write here. We have the course in right now in 3 languages. Of course, we have it in English, we have it in Turkish, and we have it in Hungarian for now. We don't have it right now in Spanish for this time. And for English, you have to write an email to gaurang@gmail.com. For Turkish, you have to write on rumelioexanisi@gmail.com. And for Hungarian, we have our Hungarian colleague, neomihomeo@gmail.com. So all these special courses, this entire talk, more than 20 hours, I promise 20 hours, but I will at least give much more than that, at least 30 hours. And you're going to get the finest homeopathic kind of talks, lectures, presentations, notes, learnings. There is also a WhatsApp group, and I have to thank here Dr. Mokshada. We are having a WhatsApp group where every week we put very old cases of master. Just today, I think she has put a case of Grimmer, how he treated a case of a breast tumor with hyposanium, one of the homeopathic remedies. So you all, whoever participates, also gets to be part of this group. So well, I just want to take this opportunity to invite every one of you for this special course, and there are some discount available. So everyone who has joined this kind of webinar, the Irish Society, the Canadian colleagues, the Turkish colleagues, the Hungarian colleagues, there is, make best use of the discount that is available for some of you for next few hours. And it'll be great to have you, and it will be great to study together, and I'm looking forward to learn from each one of you. And I've personally chosen some of these speakers who I'm looking forward to learn from, and that's going to be very special. It'll start in less than 2 weeks, so I hope to see you very soon. And maybe we just have a little bit more time, and maybe we can take some questions, maybe 3 4 of them, just to make sure that we can answer some of them. And I'm going to request my colleagues in Turkey and Hungary to check if there is any particular question they look. And I'm also going to ask Oana if they can see any particular question. There is a Turkish question from, I think, Sengul Usyal, I think, is a Turkish colleague. She write, was it a malignant tumor? No, it is a benign tumor. Actually, it's a Chalzion. It's not malignant one. Poonam Kurani, she says, if in past history of child at the time of birth had not cried, and after that mental physical retardation, how it should be correlated, what rubric should be taken, and probable remedy to consider. Poonam writes, Poonam, I recommend you to read Clark Dictionary of Practical Materia Medica and read Natrum Mur and also read Syphilinum. I would like you to read both of it, and perhaps you will find a case very similar to yours treated by some master known as Fatak, and see what he did. I'm not going to tell you what to do, but I want you to go and read it so that you will find your answer. And if you find it, and if you still don't, you can write to me on my email ID, and I will try to reply if I possibly can. Vinidhini writes, how to differentiate Chalzion and Stye. Vinidhini, you'll have to study this. How to differentiate Chalzion and Stye. I recommend you to read it. Swapna writes, lightning like pain in lower back aggravated by lying on the back. Well, lightning-like pain can be a common symptom also, but there will be a bunch of remedies, including phytolacca, including spigelia, magnesium phos, colocynth. So I recommend you to check it out in the rubric. We have one question from Turkey, I think, Nebahat Kilinki. Maybe Sopil or Ezgi can say something. Sure. Hmm.
Sorry but I can't understand. Yaş sonrası diyabet olan bir çocuk için ne olabilir? What is mean? Serpil, nasıl çevireceğiz bunu? Yaş sonrası derken Nebahat Hanım ne sorduğunuzu ben anlayamadım. Yaş sonrası yas demek istemiş. Okay. Okay. I understand. After the grief, if the child has some symptom, what you suggest for the child?
But what symptoms? We don't know.
Yes. Can you translate? There is no symptom, but if the child has a grief, for example, some person died in her or his family, what you suggest for him or her?
Well, generally the most classic remedies in homeopathy, as you already know, in grief, you know about remedies like ignatia, about natramur, about phosphoric acid. I'll recommend you to read about them. But what I want to tell you something more important is that you have to learn to elicit the peculiarities. After grief, what is the effect on the body is very important. For example, if after grief there is a lot of hiccough, the remedy is hyoscyamus. Okay. If after grief there is a lot of diarrhea, the remedy is dysentery compound, even in a child. So you have to learn the art of observation of what is the symptom that is developed after the grief. So once you get that, you will get the remedy. There are some question by Carolina. What is the point of entry in the case? Hello, Carolina. Nice to see you here. What was your point of entry into case where you gave Platanus? Carolina, this is a good question. Why did I give Platanus? What was my entry point? So that is a thing, for me, of course, it was my knowledge of materia medica. I was I was knowing a bunch of rare remedies for kind of styes or for tumor of the eye. So that is something I already knew through my knowledge of boric materia medica. But of course, there are certain softwares, there are certain repertories to find these things out. I'm going to try to show you this. So what you can do is, you can go into, I'm going to show you here. You can go into boric repertory. Let's see, boric repertory. Okay. You go in boric repertory and you look at eyelid. Okay. And then you can try to find out if there is any kind of symptoms or any kind of rubrics which resemble the situation of the tumors of the eye. So that's what I would normally do. This is one possible approach. The next is you can straight away look at, right? You can straight away look at a rubric in a complete repertory also, like styes, for example. Here you can see. And there are 136 remedies. One possibility is to read each remedy like this, Cassia sophera, Lapa, and from there somewhere you will find, okay, there is Platanus. So that's another way. So these are the different ways. The way I do it is mainly because once you read Boric a few times, you automatically know gradually that there are certain remedies, small remedies for different pathologies. Yeah.
Can I ask question?
Yes.
After the, yes, there is some question Pınar asked you, and after the grief, if there is a diabetes, what you suggest?
Right. I'll just try to write it here. Okay. Let me. Yeah. So the question here is, we'll just talk about diabetes here because diabetes is also going to be one of the topics in our talk in the geriatric course and ophthalmology course. So let's talk about diabetes. So generally, if the grief is too much and that causes diabetes, the number one remedy, of course, will have to be phosphoric acid. Although you also want to study other acid remedies, for example, lactic acid. Although in lactic acid, it will be more rheumatism with diabetes and grief. In phosphoric acid, along with this, there will be a lot of weight loss, a lot of urination, and a kind of a detached state in phosphoric acid. Generally, when there is grief and then diabetes, the other remedies that I think about is natrum mur and other natrum salts. But I also think about a very interesting remedy. It's called as alloxan. This is a very important remedy, which is kind of a synthetic drug, which was later proved into homeopathy by a gentleman known as Stephenson. He has done some provings of alloxan. So this is another fascinating remedy which I use. Alloxan has a resemblance with natrum mur. Then there are certain important remedy. One of them is uranium nitricum, where there is a lot of food habits, digestive habits, and a lot of high responsibility and high ego that can later on cause diabetes. One of my favorite sarcode is also insulinum. In certain cases, I might just give insulinum 6C and I might give it once a day for about 1 month to see the results. So there are so many different remedies. There are also some Indian remedies like Syzygium jumbolinum. You generally give this in mother tincture. You give it 6 drops in half a cup of water daily. And generally, in this case, there is diabetes along with skin problems in Syzygium. The other remedy that I often use is Cephlandra indica, which has diabetes along with a lot of heat flushes in the body. And Gymnema sylvestre, which has diabetes plus a lot of gastric symptoms. So this is a little bit about the uh,
Can we see your screen completely about
yeah,
this part? We can see very limited right now.
okay. Let me see how to open this. Hmm. Yeah, can you see it now?
Not all of them, but some part, yes.
Yeah. What I can also do is I can give you this document. Will that help? I'll also put this into, I'm going to put this into the chat here. Okay. I'm going to put this into
Okay, it will be great.
host and panelist. No. Okay. I'm going to put this here. How do I do it to everyone? Perhaps I can ask Mokshada to put this for everyone. And I'll also ask them to send this on WhatsApp. Okay. Perfect. Any other question? Anything from the Irish society side? Any questions? Any questions from Turkish group? from SG's group, anything from Hungarian colleagues, Canadian colleagues, anywhere, our Indian friends, anyone. Perfect. So, anyways, I think I just want to very quickly thank our clinic team and colleagues to help for this presentation. Thank you, Dr. Jaya and Dr. Mokshada and Dr. Utsav, Aishwarya, Dr. Srishti. Also, thank you so much for joining today and helping us. And of course, special thank you once again to the Irish homeopathic colleagues. Um, Special thanks also to um, SG and Serpil to do this last minute for our Turkish homeopathic family. And of course, Naomi, thank you so much for making this happen for our friends in Hungary and everywhere.
Not sure if I'm unmuted or I'm muted.
No, you are unmuted. We can hear you, Moana.
Great. Okay. I was trying so hard to unmute myself.
No,
Yeah.
you are a panelist. You can join anytime.
We have plenty of questions, but I think even if we stay 3 or 4 more hours, we're still not going to finish the questions. So, yeah, and the best way to learn more is through cases, I think, and it's great that to get us back on track after Christmas and after holidays. So, thank you so much, Dr. Gaurang, on behalf of Irish Society. And I really hope everybody is happy and that they joined the webinar. And I'm really excited for the course to start.
Thank you. Thank you, everyone. Thank you, each and every one of you.
Thank you, everybody, all of your team that organized this and made it possible. And thank you, everybody, for their help and for the participations. And yeah, have a nice day and see you soon at the course.
Okay. Thank you. Thank you so much.
Thank you.